So we are going on with section 10, or I should say chapter 10, section 2 of your biology, and we're talking about the heart. And we were talking about the artificial pacemakers and electrical system of our heart. And we're going on to our heart at work. So our heart at work, the pump, we have a systole and a diastole. The systole is the highest blood pressure. That's when the heart is pumping its hardest, is that systole. And the diastole is when it's at rest, when the heart's at rest. And so when someone's taking your blood pressure, the top number is going to be the systole. That's the hardest it pumps. So it could be like, say you have a blood pressure of 120/80. The top one would be the highest pressure in your heart, and the bottom would be the lowest pressure in the heart. The top would be the systole, and the bottom would be the diastole. So we're going to go into later on how to take a blood pressure, but that's basically your heart. It's working at its hardest, and then it's rest. It pumps like 2,000 gallons through each day, so it has to work hard. And 2.9 million liters each year are 760,000 gallons each year. That's a lot of blood pumped through. So the cardiac cycle goes through the top, the contracting and pumping, that's the hardest. The contracting cycle of the heart is called the systole, and then the relaxing and filling stage is called the diastole. And these go through the AV valves, the valves pumping. The atria contract, the ventricles relax and fill, and the ventricles contract, and then the atria relax. So the ventricles, when they're contracting, the atrium are relaxing. The two atrium are relaxing. And when the ventricles are relaxing, the atria are contracting. So they do opposite. The atrium, the top part of our heart, and the bottom part of our heart. So this picture is has to do with our sympathetic, regulating our heart, and our sympathetic and parasympathetic nerves that actually activate our heart. But also, let's talk about a little bit about the heartbeats and the sounds, because the sound is perceived as a heartbeat. When the doctor listens to your heart, there are two sounds. One's like a long, low-pitched lub, lub, and then the shorter, high-pitched dub, dub. So lub, dub, lub, dub, lub, dub. That's a heartbeat. Lub, dub. That sounds like your heartbeat. So the lub sound, lub, that's when the ventricles are contracting. And the dub sound is when you hear the AV valves slamming shut. So it's the shorter high pitch. So lub dub. So if you're listening to your heart goes lub dub, dub dub, dub dub, dub dub. That's how your heart. So that's what the doctors listen to when they're listening to those sounds of your heart. If you have a valve problem, there'll be an abnormal, like a sound, like a blowing sound. And that means you have a heart murmur. And usually a heart murmur could be nothing. It could just be that you were born with a little heart murmur, no big deal. It's a little bit back up there, it doesn't bother you. Or it can be a big problem with your valve leaking, right? Blood leaking back into the wrong chamber, or the chamber of your heart. And this can be, the heart murmurs can be caused by a bacterial infection, or just a genetic malfunction, or some kind of problem otherwise, as for atherosclerosis and those kind of things. But anyway, it's actually a murmur. Your heart is not working totally right. There's a backup of blood. So that's the heart murmur. Well, regulating the heart output, when we talk about this, these are the regulators. So this is the picture that I have here. This is your brain, the medulla oblongata, and it's going to regulate your automatic nervous system. And your automatic nervous system comes from, because your heart's going to pump automatically. You don't have to think about your heart pumping. So here we have automatic nervous system, and you have two big nerves, the vagus nerves that comes down here to the SA node, and you have the sympathetic nerve, or sympathetic accelerator nerve. Accelerator means to accelerate, means to go faster. So the sympathetic nerve makes it go faster, and the vagal nerve slows it down into the parasympathetic. Remember, the sympathetic nervous system is that when you're really scared and flight or fight, or you're afraid, or you're something's happened that just startles you, or you have to go to the doctor and you're like, oh my goodness, I'm afraid, and all of a sudden your blood pressure's up and everything. And it's because of your sympathetic nerve. Now, then when everything returns to normal and you're going to go to sleep and everything's relaxing, and goes back to the vagal nerve, making everything relax. So it goes to your brain, all this. So the vagal nerve slows the heart, and the accelerator nerves, the sympathetic, makes it go faster. Your heart rate normally is like around 120 over 80, but when you can get up to almost 200 beats per minute, when you get really scared, or just all of a sudden your heartbeat just goes faster. But when you're sleeping, your heartbeat is like only 50 to 60. It's really relaxed. The heartbeat goes lot slower when you're sleeping. So let's go on to here. See if we can get this. Hopefully you can see this here. There we go. We're going to talk about heart failure. When your heart fails, so usually when you get older, you have people with heart failure, not young people like you guys, but a heart attack. What is it? It's when the heart is deprived of fuel and oxygen, and possibly because the blocked blood vessels. Your blood vessels are being blocked by things like plaque inside your blood vessels. And these coronary arteries are usually, they're the ones that that have the most detriment to our body, because they can actually clog our blood that supplies our heart, and we can have a heart attack. So, and once a heart attack, you can lose power within minutes. The heart will cease to contract, and then your coronary arteries just totally blocked. That would be but you have a lot of coronary arteries, so if one's blocked, it might be okay. But if all of them are blocked, you might have to have bypass surgery or such. So the coronary arteries provide detours if they're blocked. So if one is blocked, they have a detour. So the larger portions, though, do not have detours, and so they can have a cardiac arrest. 800,000 Americans a year can die. Actually, 800,000 are affected, and 100,000 of them die. And if you have just part of your heart, you may lose part of your heart, may die. And then you'll have a less use in your heart. So the dead muscle will be replaced by scar tissue, and then the scar tissue may lead to death later on in that part of the heart. So here we have the heart attack happening. Remember, here's the coronary arteries here. So here's a normal artery, then the fatty deposits, cholesterol and fat deposits, triglycerides and all this stuff you're eating starts fatty deposits building and narrowing your heart right here. And then the fatty deposits may rupture through the artery wall, and then you'll have a clot. So they can just bing, and all of a sudden a clot will come out, and that clot can give you a stroke. Anyway, here's a vessel that's almost totally obstructed, and obstructed by a clot, causing a heart attack. So once it's blocked, a coronary artery is blocked, it causes that heart attack. So let's see here. All right, now we're going to talk about, I forgot to talk about another thing, is what's called VFib, or ventricular fibrillation. That's when the heart stops beating, not because of the plaque, not because of coronary artery blockages or anything, but because suddenly the electrical system of the heart is affected, and your heart just starts twitching real fast, doing nothing, just like it's having a convulsion. So your heart just twitches like a convulsion. Your ventricles, the bottom part of your heart, are fibrillating, and that means they're moving without pumping, and this can cause you to have a heart attack too. And it's a damaged electrical system. So how does the electrical system get damaged? Well, it could be damaged by drugs. If you're out especially the drug cocaine, heroin, those kind of drugs, if you OD, it can put you into ventricular fibrillation when you have a healthy heart. Or if you get electrical shock, say you're shocked, by electrical wires, or you get hit by lightning. That's another thing that could cause ventricular fibrillation, where the bottom of your heart just twitches. And the victim, the person that's struck by this electrical shock or drugs, whatever causes it, becomes unconscious in 10 to 15 seconds and may die in 4 to 6 minutes. This is why CPR is good on these kind of people that have healthy hearts, especially because you can sustain that CPR, that oxygen to the heart, and the heart beating until you get what's called a defibrillator. And this defibrillator is a brief electrical shock, and it's a jolts the heart back into their electrical system. So, and usually the defibrillator works pretty good on a healthy heart. CPR keeps a person alive until you can get a defibrillator. Now they're putting defibrillators everywhere. So now it's really weird because something is happening where a lot of young people are having heart attacks, and I'm not going to go into that subject because we'll get into these. I call what's going on is very political. So if I even mention what's going on, but anyway, there's a lot of young people now that really need defibrillators because they're getting what's called the jab, and you know what the jab is, and that jab can affect your heart. Let's just say that. I'm not going to go further into that. So anyway, heart surgery. So this has to do with heart surgery here. So heart surgery, repairing the heart. Let's talk about repairing the heart. So the heart, repairing wounds. So say you have birth defects, and a young baby has birth defects. So they need to go on the heart-lung machine so they can stop the heart while they do surgery on the heart and repair those parts of the heart. So they put them under anesthesia. They go up to anesthesia, and they put them on this heart-lung machine, which removes the CO2 and adds the oxygen. So for quite a few hours, 5 or 6 hours, maybe longer, 10 hours, 12 hours, however many hours, they're on the heart-lung machine. They call this open heart surgery, or bypass. They'll try to put in a bypass, a coronary that's clogged, to get rid of a clogged artery. Bypass surgery or open heart. So if a person needs to have open heart surgery, and we know, okay, their blood vessels are clogged, there's a different way. They can have what's a coronary bypass, which is basically taking a large vein out of one of their legs and using this vein and make a vein so they could put in for the coronary vein, replacing it because their vein is damaged. And this is quite a big deal, and it's usually the coronary bypass is called open heart surgery. And that's because you have to open your chest cavity. But they also have another thing called an angioplasty, and these don't have to have open heart surgery. And they put a catheter through your arteries in your leg, and they have a little balloon tip, and they go all the way up to your artery with this balloon tip, and then they put stents in, or they open that artery up with this balloon tip as far as they can. And if the artery is not staying open and the blockage is still there, they'll put what's called stents. And these stents are little tiny metal braces that hold the coronary artery open. So amazing, isn't it? So, and then there's also valve replacement. We talked about that. And then usually valve replacement will have to have, I don't know if it always has to have open heart now, but it used to be. And so valve replacement basically removes the valve, and they have to put a different valve in. So if you have a tricuspid valve or a pulmonary valve or whatever valve it is. And so how they do this, they basically take a pig valve, and they use the pig valve, and they treat it and wash it so there's no antigens on it, so they won't be rejected, and they replace it. Or now they have mechanical valves that are steel and plastic, and they can put those on and replace your valves in your heart. It's pretty amazing. One of my friends had that done too. So that's causes, but you have to have open heart surgery for that. So, and then of course we have heart transplants. Well, that's when maybe somebody has a fatal accident, and then they donated their heart, and so they take their heart off and they bring it to a person that's needing a heart. And so it takes a very special doctor to do this, that's for sure. And it also takes a lot of drugs to suppress their immune system, because when you're getting a heart from somebody, a lot of times your body wants to reject that heart. And it's also, you're very susceptible to infections. So there's a lot of complications that can have with a heart transplant. And now they have what's called, and this is this picture here, they have what's called LVAD. It's the left ventricular assist device. That means it's going to assist your left ventricle of your heart. So it's a heart to assist your heart until you can have a heart transplant. And it's a partial functioning heart. And it pumps blood from the left ventricle into the aorta for you, so it decreases the load of the heart. And it's just temporary until you may get a heart transplant. But sometimes it may be permanent. So here's the heart. There's the pump, how it's collected, the control unit, and how it's going to make the heart beat. And now they even have some mechanical hearts that they're trying to put together. Mechanical hearts when a person can't get a heart transplant. So that's crazy. But they do. It's happening now. So let's go on up. That's it. We're finished with the heart. And now we're going to go on to the circulation to every cell.